Hi, welcome to Investigate with Kate. Today I'm interviewing Dr. Sean Bradley, who works in the sports medical field. So we actually asked you this beforehand because it stumps everybody. But in my opinion, the 80s is the best decade for music. How would you describe your job using an 80s song title?
Yeah, I think that's a great question, and I'm very happy I got a little headway on that one. um, I came up with two, and I
Okay.
think they correlate very well together with what I do in sports medicine. The first one I would say is John Cougar Mellencamp's "Hurt So Good." Don't know if you know that one. That's a good one. You should go home and listen to it. Not so much about hurting like from a musculoskeletal injury or something to that nature, but people come in all the time to clinic to see me because they generally hurt. Something hurts, something's bothering them. But I like to transition that, and maybe halfway through, we kind of slow transition into like we are the champions from Queen, right? Because that's like the goal is to get everyone back to what they want to do, whether it's back on the football field or the basketball field. Really, the goal is to get people back to the activity they enjoy to do, and that's kind of my goal as a sports medicine.
How did you decide to become a doctor?
Yeah, I think if you talk to anybody in the medical world most days, they generally say they want to help people, right? And generally help people in some way or form, and help people feel better, right? I also wanted a challenge. I wanted some career or something that I do on every day that I feel like I learn something still every day. And I think the medical field, it gives that kind of duality of being able to help people at the same time as continue to challenge yourself and learn.
Also, you have a direct route to someone if you are
Oh yeah,
having
I've had my
problems.
own injuries myself, so I'm lucky enough to have colleagues who help take care of my needs these days too.
What is the funniest thing that has ever happened to you at work?
Ooh, I don't know if it's funny to me that's happened to me, but as something that I like to do and try and make a part of my practice when I see people in clinic, right? Because people come in and they hurt all the time when they come and see me and aren't having their best day. Actually, my goal is always to try and make someone smile or laugh. So no matter how bad they hurt or what's going on or how bad the news is, my goal is always to make someone smile when they come and see me and try and lighten the mood, to try and get them to have a little bit better part of their day for what they came in.
How has sports medicine changed over the years?
Yeah, I think if you think about, even 20, 30 years ago, there weren't people like athletic trainers who help people on the sidelines and, at high schools and those kind of things. And I think the progression, not only with the amount of care and providers from doctors, physical therapists, nutritionists, psychologists, there's a lot of parts to the team now that we know are integral and important, just like the mental health and nutrition is compared to how well the knee functions, right? So those things have changed dramatically over the last 20 or 30 years. And I would say that's probably the biggest shift along with just technology in general, right? Ultrasound, MRIs, those kind of things.
Yeah, like when you look at what they had for the internet in the 80s, like um basically didn't exist.
Yep.
What does a typical day in your work life look like?
Yeah. I mostly see patients in a clinical setting. So I come to work, and usually patients are in a couple different clinic visit rooms for me. We talk about what their what's going on, where they hurt, or what's the concern they have for the day. We usually review some X-rays or MRIs or ultrasounds, potentially do some injections or some small procedures in the clinic if we need to. And then, depending on what season we're in, I can end up at a football game that night or a basketball game, or whatever other kind of event we may have going on as well.
So when we were getting the tour, we went into the recovering room.
Oh, the recovery room? Yeah.
Yeah. And we saw something very interesting. Can you guess?
Was it the cryo chamber?
Yes.
Yes.
She opened it and a burst of cold air came out and it froze my toes because I have sandals on.
That's part of recovery. And just like the cold bath or cold plunges you see people maybe do these days, that's another form of that to try and allow the muscles to heal a little bit faster. We think that may be able to do that. But yeah, it's chilly. You have to wear mittens and things to cover your ears and your feet when you get in there, and you can only be in there for a couple minutes. So
Yeah. Or else you might literally freeze to death.
well, there was a famous football player a couple years ago who ended up doing that, and he didn't have socks on, and he ended up with burns, freeze burns, like almost frostbite on the bottom of his feet.
Best way of preventing getting injured so people don't end up at your office?
Yeah, I think that's a great question. And I think to some degree, it involves actually being active on a regular basis, right? I think a lot of the injuries we see, happen when people maybe haven't been exercising, try something new, something they maybe not were prepared to do, and that's when we see some more, some more concerning type injuries. But you can't prevent them all, and no matter how safe you want to be and how active you are, injuries happen, and that's why we call them accidents, right, or injuries. It's something that kind of comes with staying active. But my goal as a sports medicine provider is always to try and educate people on the benefits of exercise and encourage people to become more active because we know that leads to a healthier life.
So you can't fully prevent it, but you can tell them a way to help prevent it hurting.
Sure. Yep. There's certain exercises that we'll prescribe to patients to strengthen different muscle groups that potentially can help prevent the knee from injuries or ligament injuries and things like that. So there are things we can do from a maintenance and recovery standpoint that can hopefully prevent injuries, but nothing's perfect.
What is something that you learned in elementary school that you use every single day in your job?
Yeah, I think it's a little cheesy, but I think the things I learned growing up were to treat others with respect and to treat others like you would want to be treated. And I think that's something that I try and do every time someone comes in with an injury, right? Is to treat them like a patient, like I would want to be treated if I was going to see somebody. Um, I think that's something that's kind of stuck with me and probably is something that I learned when I was growing up and your age.
Especially if you're in the I don't really want to say customer service, but if you have to work with people, you
You have to treat them right.
hmm
And I think that's a lot of growing up at your age and is learning how to treat people the right way and treating them again with that respect that you would want to be treated with.
Thank you for watching Investigate with Kate. Check out Dr. Sean Bradley, and their grand opening of the facility is coming up in what month?
It should be next month.
And it should be next month.